Here's the system that I used to take control of my low back pain and regain my life. Here we go. In video number 1, I talked about the 2 biggest low back pain mistakes that keep folks in chronic pain. Big mistake number 1 was ignoring pain triggers. And big mistake number 2 was relying on passive treatments. When it comes to pain triggers, we talked about the importance of learning your pain triggers and avoiding your pain triggers to allow the injury to calm down or to allow your nervous system to calm down. And we talked about how critical that step is in your long-term relief, because if you ignore that step, all the treatments in the world, including surgery, will not fix your problem. Okay. In video number 2, I started to give you a glimpse of what I did to take care of my own low back pain issues. They included increasing mobility above and below the injured area, and it also included learning to stabilize the core musculature around my spine and my hips to change the way that I moved. The system that I use to help my patients and my clients, and that I also used to help myself, is called the BacktoLIFE protocol. And it involves 4 main pillars. Pillar number 1, limit pain triggers, is the big one. If you skip this one, there's just a limit to how much success you have with everything you do afterwards. So this one is crucial. There's 5 components to it, and I'll go into each one. Learning to move with a neutral spine, learning the difference between flexion and extension intolerance, learning to brace the abdominals, learning to move from your hips, and then finally integrating all these into your daily movements and learning how to move throughout the day while protecting your spine. So learning to move with a neutral lumbar spine basically means making sure that your low back, your lumbar spine, is in a position where the vertebrae are lined up nicely. When you're in this position, you can handle heavy loads. You can pick things up. You can carry things. You can perform these movements safely without being afraid of injuring any tissue injuries that you have, and also without being worried about setting your nervous system on fire. Now, if you're not lifting anything, you can be a little bit more flexible with your movement. It's not quite as important to maintain a neutral lumbar spine, but when you're healing, when you're recovering, it's absolutely essential to be able to learn this position and to put it into practice. Flexion intolerance and extension intolerance. Most folks with low back pain are either sensitive to one of these or both of these. Flexion intolerance means that you have increased pain when you bend forward to pick something up, for example. When you bend forward, it puts stress on the tissues towards the back of your spine and it recreates your pain. Okay, so this may be more closely linked with something like a lumbar disc herniation. That happens a lot. Extension intolerance is more typically seen with something like spinal stenosis or facet irritation of the facet joints in your spine, or a spondylolisthesis. This involves when you arch your back backwards, extending your spine, that recreates your symptoms, that recreates your pain. So learning whether you are flexion intolerant or extension intolerant or both is absolutely crucial to beginning your recovery process so that you can avoid those movements. Learning to brace your abdominals is beneficial to almost anyone who has low back pain. There's a difference between bracing your abdominals and drawing in your abdominals. Bracing your abdominals involves tightening these muscles basically to form a protective belt around your spine. Okay. And what this does is it stabilizes your spine, which is especially important when you're handling loads, when you're picking things up, when you're carrying things. This really helps with maintaining a neutral lumbar spine. And also a big part of this is learning to separate bracing your abdominals from breathing. Okay. Most folks have a hard time with this. Most folks, when they need to breathe heavily, they have to relax their muscles so that they can breathe. When they have to relax their muscles, it puts their spine at risk of buckling or injury if they're carrying something heavy or if they're picking something up. If you can learn to brace your abdominals, hold that contraction while continuing to breathe, it enables you to do things with so much confidence. Picking up your kids, picking up your grandkids, carrying groceries, picking things up off the floor, all sorts of things. If you can separate your breathing from your abdominal bracing, it's really a good feeling. You feel very confident with your movements, and you know you can do things without hurting yourself. Learning to move from your hips takes pressure and strain off of your lumbar spine. If you can learn to generate your movements from your hips, rotate from your hips while keeping a neutral lumbar spine, it allows your spine to calm down. It allows it to heal. It improves the way you move. And it really does become easy to where you don't think about it anymore. So that's a crucial step. And that's a big part of limiting pain triggers is learning to move from your hips. And finally, integrating these first four parts of limiting pain triggers into your daily routine. So putting all this together and learning how to get in and out of bed without hurting yourself. Up and down from the chair, in and out of the car, up and down stairs, picking things up, carrying things. When you can integrate these things into your daily movements, it helps you avoid your pain triggers. It allows you to recover. It changes your life. Pillar number 2 is increasing mobility, specifically above your lumbar spine and below your lumbar spine. So this means your upper back, also called your thoracic spine, and your hips. Increasing thoracic mobility, which is your upper back, it improves your posture, and it also allows you to use your upper back with your hips to generate movement while letting your lumbar spine stay in a neutral position. So it's a very beneficial technique. There's a limit to what it does by itself, but when you combine it with these other mobility techniques, it's highly effective. Increasing mobility in the hips is crucial to taking strain off your low back. If you can increase the mobility of your hips along with your thoracic spine above your low back, those two together completely change the way you move. So specific to the hips, stretching the hip flexors usually helps most people in today's society with tight hip flexors. That's usually very beneficial. Also, increasing the rotational mobility of your hips. That allows you to generate movement from your hips instead of twisting from your low back. So this is a game changer along with thoracic mobility. Pillar number 3, foundational core stability, involves two main parts. Okay, core stability specifically to your lumbar spine and your abdominals, and then core stability related to activating and strengthening your glutes. Your lumbar spine is meant to resist forces coming from all different directions, and you have to be able to do that to maintain a neutral lumbar spine. And so you have to be able to resist forces from each side of your body, resist forces from the front and the back of your body, and also resist rotational forces. So training your core to be able to resist forces from all these different directions allows you to maintain a neutral lumbar spine and truly gives you the confidence to pretty much do whatever you. Earlier, we mentioned generating movement from the hips, strengthening your glutes. The two major glute muscles we would strengthen for most people would be your glute max and your glute main. Your glute max is going to improve your hip extension strength. That's going to aid you when you're picking things up, when you're carrying things. It's going to take stress off your low back. And then your glute min is going to help with your stability and standing. It's going to help prevent your spine from shifting side to side. So targeted, intelligent strengthening of the glutes allows you to build powerful hips that you can generate your movement from instead of your low back, and really can change your quality of movement in all your daily activities. Pillar number 4 is endurance. Ideally, improving how far you can walk. And this is important for a couple different reasons. Number one, just improving your overall functional activity tolerance is hugely important for a variety of reasons, all sorts of health benefits. Walking produces a rhythmic motion that is fantastic for your spine. It improves blood flow and lubrication to your spine and to the joints. Your spine is happy when you walk. Also, we talked about uh, hypersensitivity of the nervous system. Implementing a gradual incremental walking program where you make small steps to increase your walking distance, not too quickly, but very slowly, allows you to retrain your nervous system to be able to tolerate uh, higher volume of a higher volume of activity. So, an incremental, intelligent walking program to improve your endurance, to decrease your nervous system hypersensitivity, and to make your spine happy. And also, it really just it gives you the confidence if you know you can walk a certain distance without reaching pain. Um, you can leave the house again. You can go to activities, sporting events, weddings, church, family get togethers, shopping. You can do all these things if you're confident in your ability to walk certain distances without having to sit down or without having to ask somebody for help. So that's the Back to Life protocol. That's the system that changed my life. And that's the system that I've used to change the lives of countless patients and clients over the past 17 years. Uh, Severe low back pain was my reality for a long time. I shared in my previous video how I herniated my lumbar disc, how I had to crawl on all fours back into my home through the freezing cold weather, how I couldn't do things like lift a pan of muffins without my low back spasming, how I had to walk around trying to do my job with a TENS unit on my back, how I was getting injections after church because I couldn't hardly stand up, and I was getting spinal manipulations, I was getting massages, just a really it was not fun. It was very discouraging. And this is the system that I used to get my own life back. The turning point for me, I mentioned in my previous video, was my lumbar disc herniation. And that was the turning point because that's when I realized that I needed to make a change. And that's when I learned to practice what I preach. And I started to learn and avoid my pain triggers. That was the big turning point. Once I avoided my pain triggers, I began to feel better. I started to get some confidence back, and I began to more aggressively rehab my low back. The journey was not just an improvement every day. There were ups and downs. Like I mentioned with lifting a pan of muffins, there were times where my low back would spasm, and I would almost panic because I thought that I had undone all the work, all the progress that I had made. I had that instant fear when my low back would grab me. I had that fear that I had undone all the progress and that I would be starting over. So, anyone that struggles with low back pain knows exactly what I'm talking about. I had to learn to stop what I was doing immediately, and I had to force myself to do that incremental walking program because otherwise, going back to the bed or to the recliner was just a ticket to failure for me. I had to find a way to keep moving without making myself hurt more, and it worked. So there were some ups and downs, and some days were better than others, but we got through it. And I believe if you're watching this, I truly believe that you can get through it as well. And I shared in my last video where I am today. I am in my 40s. I am pain free. I do kettlebell training. I jump on the trampoline with my kids. I wrestle with my 9-year-old son. I play a little bit of golf, which I'm terrible at, but I love it. I can swing a golf club without thinking about my low back. I literally don't think about my low back. And that's not to brag. I'm grateful. I'm relieved. And it's possible. So my quality of life right now, I'd say is fantastic. And I'm just grateful because I've been in those bad spots where I couldn't move. And anyone that has low back pain knows that when you have an episode, you can't do anything. If you reach for something with your arm, it hurts. You turn your neck, it hurts. You pick your leg up, it hurts. You can't do anything when your low back is spasming and locking up on you. So I am living proof that there is hope, that you can go from crawling on your hands and knees in your freezing cold backyard, you can go from that to living a normal life. If you want help from me, my Back to Life spine course will be opening up very soon. It's a self-paced program where I literally take you by the hand and I walk you through this process step by step. And I teach you how to manage your low back pain. I teach you how to move better. I teach you how to take serious steps towards improving the quality of your life. And again, this is the program that I use for myself. So be on the lookout for that program to open up, and feel free to reach out to me if you have any questions. And I love showing people how to take control of their low back so that they are not dependent on healthcare professionals for the rest of their lives. So thank you for watching today, and I hope this was helpful.